Royal Majesty, don't worry, we are going to start soon. You are all welcome. How are you all doing? How has your weekend been? Can you all hear me? Chioma Okechukwu, the Suave Interiors. All right. How are you? Let me know if you can hear me. On Facebook, can you hear me? I think there are about two or three people on Facebook. Um, Ayaba, you can't hear me? Are you serious? You should be able to hear me. Oh, sorry. Can you hear me now? Can you hear me now? Let me know if you can hear me. Good evening. Oluwatosin Bukola, good evening. How are you? Let me know if you can hear me. Alright. Yeah, that's good. On Facebook, can you hear me? Joye Wole or Joye Wole 200. You are welcome. Alright. Alright. Thank you. Olori Olubukola Adeniran. You are welcome. Allen Temitope. You are welcome. Alright. You are all welcome. I just want to give us some time for people to. You can't hear me still. The Suave Interiors, can you hear me? You said you can't hear me. Other people can hear me. Let me know if you can hear. Maybe it's from your side. Because people said they can hear me now. The Suave Interior, let me know if you can hear me. Let me know if it's better. Divolos, you are welcome. Um, I just want to give people time to join us before we start, so that you will not miss too much. The Suave Interiors, let me know if you can hear me. If you can't hear me, that means it's from your side. Can any person not hear me? Or is there any other person that cannot hear me? Gina, you're welcome. Um, Dr. Val, it's nice to have you here. Um, um, if you cannot hear me, let me know. At least other people say they can hear me. But if you can't hear me, let me know. Can you all hear me? At least I know they can hear me on Facebook. Someone said they can't hear me on Instagram. But I want to know if Instagram people can hear me. The Suave Interiors, can you hear me now? Alright. If you can't hear me, let me know before I start. People are not responding on Instagram. Gina, can you hear me? Sinwa, alright. Royal Majesty, thank you. Alright, so yeah, thank you. I think the person that said she can't hear me, that means it's from her side. Alright, so Dr. Sheyi Adelekun, also known as Dr. Sheyi. And I always like to say a little bit about myself before we start, so that you can have a little idea about me, and so that you can know who you are actually communicating with. So I'm a gynecologist and I'm an obstetrician. I'm a fellow of West African College of Surgery, and I've been practicing in this field of gynecology for more than 12 years, and I've been able to help women conceive and go through pregnancy to delivery. And over time, I found out that major problem with majority of people that are trying to conceive or that are pregnant, because I've seen a lot of women, at least I've seen a lot of men come down with complications from pregnancies. Some people died, some people their baby died, and I found out that the major problem is information. At least about 70 to 80% of the problem is information. And if information can be given to people, I know that it can solve a lot of problems. And that was why I started this online Ask Dr. Shay. And that's why I started it. That was about 3 years ago. So that I can give people information. I can give people opportunity to have one-on-one with me, an opportunity to have a second opinion. I don't know everything, but the little I know, I've been able to help a lot of people. Guys, you cannot know everything. It is from where your own gets to, that is where the other person starts. But at least I've been able to help a lot of people have the right information about conception, about pregnancy, and all sorts. So today is another day that we are going to talk about another thing. Especially, we are talking about we are looking at conception, and I've had various people come to meet me online that they tell me that, doctor, I have problem with they said I have tubal blockage, and then they will ask me how can they treat it. And I feel okay, it's time for me to, instead of talking to one person at a time, let me have an online talk with people where we will talk about the problems of tuber blockage, what tuber blockage means, what are the problems, and all of that. Odewumi Olamide, good evening, you are welcome. All right, so like I always say, that getting pregnant, it can be difficult, it can be delayed, it can be stressful and frustrating, it can be almost impossible, or I mean, sorry, it can be delayed, it can be expensive, it can be adult, but it's not impossible. It's not impossible to get pregnant, but it may be difficult to get pregnant. It may be delayed, may be prolonged, it may be expensive, but it is not impossible. As long as you have money, as long as you have the right people, that you are meeting the right people, getting pregnant is not really um, impossible, because there are various options now that are available to women or couples that can, even people that are not in places where we have people that are not even getting married, they are also getting pregnant. As long as you can get somebody to donate egg for you can get somebody to donate sperm for you, or you can get somebody to carry the pregnancy for you. There are a lot of options for people now. You can get pregnant now, but it may be difficult, it may be prolonged, it may be delayed, it may be expensive, it may be frustrating, but it is not impossible. And one of the major problems that I found out um, that that deals with that makes getting pregnant difficult is tubal blockage, and that is what we are going to talk about today. I have a diagram. I don't know if you can see. Can you see the diagram? Let me know if you can see the diagram. Just let me know if you can see the diagram on Facebook. Let me know if you can see the diagram on Instagram. Let me know if you can see the diagram, so that before I start talking, I will know that you people are following me. Can you see? Please let somebody respond. I'm waiting. All right, thank you, Royal Majesty. On Facebook, can you see the diagram? All right, thank you. All right, yeah. So this is the diagram of the reproductive organ of a woman. All right, thank you, Yasmin. It's the reproductive organ of a woman. This is the entire reproductive organ of a woman. And here you will see that this is the vagina, this is the womb, which is the uterus. Then this that I'm touching here, that is the fallopian tube, and that's what we are really majorly talking about today. This I'm showing you is the fallopian tube. Then this round stuff here, that's the ovary. That is where the egg is. So when a couple or when you have sex and the sperm is deposited into the vagina here, then it enters into the uterus here, and it goes like this through the fallopian tube. Then the egg comes from here, it gets into this place and it meets the sperm around this place, and this is where fertilization occurs. So the egg and sperm meet here, and after meeting they move, the fertilized egg move from this place and move back into the womb where it implants and it becomes, I mean, so if it gets pregnant, then the pregnancy continues. So we are really going to look at this tube. This is the fallopian tube, and you can see that it's a hollow structure. It looks like a pipe, just like the the hose that we use at home. You know, when you want to connect water to your maybe bucket or a big tank or something, and you can't be fetching the water, you can use a hose from the tap and take it to where you are dropping the water. So it looks like, if you look at it, it looks like a hose. That means it has an inside, that there is an inside that is like a conduit inside it. It has like a conduit inside. It's a very thin structure, very thin structure. So it looks like a conduit. Let me use something to hold it at the back. All right. So it looks like a conduit. If you look at it, it looks like a conduit, and it has space inside where the sperm can pass to, where the egg can meet the sperm. All right. So, can you see it on Facebook? Okay, on Instagram. Okay. So that is it now. So the major function of this tube is one, to connect the uterus, which is the womb, with the ovary. I've raised it up now. Can you see now? You should be able to see now on Instagram. All right, so it connects the. This is the ovary where the eggs are stored. This is where the eggs are stored, and then this is where the womb is. This is the womb. This is where the baby stays. Once you are pregnant, this is where the baby will stay. So the eggs will leave this place and enter into this place, and it will meet the sperm here. So at this point, this is where fertilization occurs with the sperm. So the egg and sperm. So the function is it has as a connector between the ovary where eggs are stored and released and the womb, or even with the outside. Because once the sperm comes up from this place, it comes into the womb and it gets into the tube. So that is the connector, it's like a connector, and it is where fertilization occurs. So if you see that, okay, you have sex and you get pregnant, it is because this is functional. And apart from it looking like a hollow structure, it has it has something inside. The thing looks like strands of hair that sweeps inside of the ovary. So apart from it being like this, it has something that sweeps inside it. It sweeps inside it. Then it has muscle that contracts. It has a rhythmic contraction that it moves. It has a way it moves such that it can help the sperm to move forward like this. And once the eggs is fertilized, it can help it move into the womb. So it has a very, 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 very important structure. I mean function. I mean two very important functions. Connecting this with the uterus and this, then for fertilization. So that means that if anything happens to it that it blocks it, that means the normal natural process of conception is already affected. That means you cannot get pregnant naturally once this tube is blocked, or once anything happens to it, either something blocks it or something damages it. Once it's damaged, that means the function has been lost. So sometimes it may not even be blocked, but those structures that I said are inside it can be damaged. The one that said sweeps inside, that sweeps inside it can be damaged. Those hair-like structures that are strands, they are like brooms that sweep inside the tube. It can be damaged. So you may even have an open tube, but the tube is already damaged. The function of it is already damaged. So that is why it is very, very important for you to understand this structure. If you want to conceive naturally, this structure is the main part of natural conception. So that means that once it's blocked, it is not likely for you to be able to, it will be very, very impossible or very, very difficult for you to be able to conceive naturally. It doesn't mean that conception is not possible, but the natural process of conception is not is going to be difficult or is not likely. So now, what are those things that can block it? What are those things that can block it? It's quite getting commoner in our environment nowadays, because people are not people are getting in fact the major one is infection. Infection is the major problem of this tube. Any form of infection, from sexually transmitted infection, a lot of people they've had gonorrhea in the past, they've had chlamydia infection in the past, and when it is not well treated, somebody will just be having maybe you just find out that you are having painful discharge, and it's foul smelling. When you pee, it's painful, and you get it after sexual intercourse, and you are wondering where you got it. Then you now go to over the counter to get some drug. They just give you one drug, and after you use it for about 2 or 3 days, it stops, and you feel okay, I'm fine. And once you feel I'm fine, then you go away, and you don't complete the actual treatment, or you don't see the right people that are supposed to treat you for it. Now, sexually transmitted infection will damage. It usually damage. I mean, it will damage this tube. Either damage that structure that I said is inside it, that air-like structure. It can damage the air-like structure, or it can even damage the tube. Once it damages the tube, it will be like you have a wound. You know, when you have a wound on your skin and it heals up, it heals with scar. So the scar will affect the inside such that it will not be able to perform its normal function. So if you have sexually transmitted infection, you have PID, pelvic inflammatory diseases, it can be a cause of tubal blockage, or you have miscarriage, or you had an abortion and it was not well taken care of. A lot of people they will go and procure an abortion, and they will not be taking care of. You just find out after the miscarriage or abortion, you start having abnormal vaginal discharge that is smelling badly, or you start having fever. You just start having fever, you start having this discharge that is smelling badly, and you didn't take actual note of it, you didn't take care of it. A lot of people they will have this bad vaginal discharge, they will not just see a reason for them to take adequate care of it. Those kind of infection can block or damage this tube. So it is very, very important for you to understand that infection is not friendly to you as a woman. Even infection, sexually transmitted infection is not even friendly to a man. It can affect the tube that sperm passes through in a man. It can block it. As it will block this one, it can also block or damage that one too. But we are talking about women today. So post abortion or miscarriage that is not well taken care of, it can affect even appendicitis. If you have appendicitis that is not well taken care of and it ruptures, it can affect the right tube, because the right tube is close to where the appendix is. So once you have appendiceal rupture, and then it's not well taken care of, it can block the tube, it can destroy the tube. So infection is the major problem with tubal blockage. So infection is not friendly to women. So that means that you have to find a way to sort out. Once you have infection, you have to be careful with it. So another thing that can cause problem is if you have surgery. There are different kinds of surgery that you have. Even cesarean section, and maybe you have infection following cesarean section, it can affect it. Or you have problem with healing after cesarean section, or after pelvic surgeries, mammectomy, and all the other sort of surgeries, and the healing process has issues. It can cause what we call additions, and that additions can either be outside or inside. If it's outside, it can cause kinking. Yeah, this one is it's just like when you have strands of strings. Yeah, strings going around the tube. And you know, by the time by the time strings is going around, I mean you have strings wrapping around the tube, then it will cause occlusion of it. It will occlude it, it will contract it and make it blocked. So additions also can affect it. Now there is something we call endometriosis. Endometriosis is, you know, this is the womb. If you look at the womb, it has an outermost structure like this. It has a bigger inner structure. This is where the muscle is. Then it has another lining here, a thin lining inside that we call the endometrium. Now this endometrium, when you menstruate, this is the end, that is what is shedding off when a woman menstruates, that endometrium, because once you don't get pregnant and the eggs are not fertilized, it sheds off, it washes it off, and that's when you now menstruate. Now this, that innermost part is not supposed to be to be located in any other place apart from the inside of the uterus. Now in some instances you can find those structures on the ovary, inside the tube, it can be inside the pelvis, it can be anywhere. Some people it will be on their navel, they will just find out that some it can be inside their bladder. When you are menstruating, you just find that your bladder, you are peeing bloody urine, or you are having blood coming out from your umbilicus during your menstrual period. That means you have something like endometriosis. That means this structure that are inside the womb is not, it has been transported to where the umbilicus is, or transported inside this thing, and it will be functioning the same way as the ones that are inside the womb. When it's supposed to be shed off and you are bleeding, it will also be bleeding wherever it is. As long as it's inside the body, it will do the same function. So when you are menstruating, it will also be menstruating. So if it is inside the tube, as you are menstruating, is menstruating inside the tube, that means the blood and all those dirty substances will be accumulating inside the tube. And as it's accumulating, it also can be damaging the tube. And as it's damaging it, it's damaging the structure that I said is inside the tube, thus making the tube non-functional again. So it can block it, it can damage the tube. There's something we call mucus plug. Now the structure that are inside, they act like broom. You know, there are sometimes that there are dirt can enter into the uterus and get to this place. So those things they sweep inside, inside the tube, they will sweep it, and sweep it, they will sweep it out, or sweep it into the uterus. Now sometimes those plug can stay inside and become solid or semi-solid, such that those things cannot sweep them again, they will just stay there. So it can block the tube. Then fibroids can also block the tube if it is located in this area. Fibroids are usually inside this muscular layer. So if the fibroid is located around this layer, or around this place, or around this place, or around this place, and it starts getting bigger, it can get big to a point that it will block this area, or it will block this area. So that means that once the fibroid gets big to an extent, or if it's here and it get big to an extent, it can take over the entire space. And once it blocks it, that means the sperm will not be able to move across and get to where the eggs are. So that is another thing that can cause that can cause tubal blockage. So like I said, infection is the commonest. Um, Sexually transmitted infection, pelvic inflammatory diseases, infection following surgery like cesarean section. Some people when they do after cesarean section, they just find out that there is a wound breakdown, but they start discharging pus from their wound. Sometimes that pus can stay inside where these structures are, and once it stays there and is not having opportunity to come out, it will just solidify and it will everywhere will just become one. It just glue everything together, and once it glues everything together, that is the end of that of the tubes. That is the end of those tubes. So you have two tubes. You can see that there is one on the right, there is one on the left. So there are two tubes. So, and that is why God is good. You know, He gave you opportunity that even if one has problem, the other may be able to function. But sometimes both can be affected, because if infection affects one, the likelihood that it will have affected the other is also there. So that is very, very important. So how do you know that you have tubal blockage? Now, the truth about it is that you cannot know that you have tubal blockage. It is not easy to know that you have tubal blockage. Why is that? It doesn't really give any sign or symptom. The only time you will know is when you are having issues with conception, and you now come to us and you now say, okay, you have to do some tests to let's do some tests for you. Let's see if your tubes are open. That's when we do those tests. We check if your tubes are open. We check if your hormones are normal. We check if your husband's sperm or your partner's sperm is also fine. That is the reason we do all these tests, to find out where the problem is. So that means that except in situations like this endometriosis or pelvic inflammatory disease, that you have serious pelvic pains, or you have painful sexual intercourse, or you have some other things that we can make us say, okay, is there any problem with this? That's when we can say, okay, maybe. But we do not know if the tubes have been affected until we do test. And so if you bring me to how we do the test, what kind of test do we do? And I'm sure most of you will have heard of what we call HSG. HSG is a form of test that we do, and you will go to where they will do an X-ray for you. Then they will put something into your vagina, and they will put it inside here. Sorry, let me take the Bible. So they will put that in here and they will push fluid. They will push fluid under high pressure into this place, and the fluid, as they push the fluid, then start taking X-ray of the either X-ray, or sometimes you can use ultrasound scan to do that thing. So we'll be following the fluid as the fluid is moving. So we expect that there will be spillage, that the fluid will come out of this place. So once we can see fluid coming out of this place, that means that the tube is not blocked. So once we cannot see anything coming out, or we see ballooning here, either this place become big, that means the fluid cannot get past the obstruction. So it now stays there and it now becomes big. And sometimes it may not even be the fluid of the HS, it may be the fluid from the structure. Those sweeping thing that were supposed to sweep it out, they were just sweeping it and it was just accumulating, and that's what we call hydrosalpinx. That's when you say you tell that you have hydrosalpinx, and that hydrosalpinx is very, very toxic. It's toxic to pregnancy. If you have that hydrosalpinx, even if you get pregnant, sometimes it can cause miscarriage, or it can even prevent you from getting pregnant. So that is why it is very important for you to understand this problem. So the other option is to do what we call laparoscopy. Laparoscopy means that you are going to take you are going to make a small cut under your umbilicus, under your navel, and put in a camera, and now be checking all these structures. You check them on the monitor. It will bring it out like this, but it will now be real time. It will show us how the wound is, it will show us how the tubes are, and you know, okay, this tube is actually blocked or not. That is the other way we can do. Then HSD, one problem with HSD is that sometimes you can say that your tubes are blocked, and it actually may not be blocked, because HSD itself, because of that high pressure of the fluid, can make especially this side, sorry, can make this side to constrict. It can contract the muscle, and once it contracts the muscle, it will occlude this space, and you think that okay, it's blocked. So most of the time, if I have a client like that has blocked tube like that, I usually ask for a repeat HSD, or I ask the person to go for a scan, because it has been found out that in 40% of cases, when the HSD says that it's blocked, it may actually not be blocked. So I usually ask for a repeat HSD, maybe 1 or 2 months after. I ask for a repeat HSD, or I ask the person to go for a laparoscopy if the person can afford it. Can go for. You can't hear me again. Royal Majesty, can you hear me? Can everybody hear me? Please let me know. Somebody said she can't hear me. Are you guys following me? Please let me know if you can hear me. Somebody said you can't hear me here on Instagram. Can you hear me on Facebook? So that I won't just be talking like that. You will not hear me. Please let me know. Let people respond to me, please. All right. Thank you. On Facebook, can you hear me? That means it's from your side, though. Royal Majesty is from your side. Maybe you should check your. On Facebook, can you guys hear me? Please let me know. Can you please respond? On Facebook, can you please respond? Olori Olubukola, can you hear me? Yasmin, Spin, can you hear me? Sapphire Jide, I will answer your question, but can you hear me? Just let me know you can hear me on Facebook. Facebook people are not responding. Are they asleep? Are you guys asleep, or am I too boring? Am I sounding boring? Please, Facebook people, am I sounding boring? Just let me know if I'm boring. If I'm sounding boring, please. At least answer me. Facebook people are refused to answer. Alright. Okay. Oh, sorry. Alright. Okay, they can hear me. Alright. Oh, okay. I thought I saw them. Alright. Okay. Let me let me continue. Alright. Thank you, Jide. Alright. Okay. So, where was I? Uh, that was I. Okay, I was talking about HSD. Alright. So that means that sometimes I usually ask for a repeat HSD. Thank you, Facebook people. They are woken up. Alright. So I usually ask for a repeat HSD for me to know if it's actually um thank you, Divine Grace. So for me to know if it's actually totally blocked, or it's just because of the HSD, because sometimes the HSD can cause. Thank you. I can see that you guys are responding. Odewumi, thank you. I can see that you guys are responding. So I usually ask for a repeat HSD. For my network is kind of slow. Ulexi, I think it's your side though. People can hear me. People are following me. I think it's your side. Maybe you check your own network. It's not my network. I think my network is very good on this side. All right. So where was that? HSD. All right. So I usually ask for a repeat HSD. All right. Okay. Thank you. Odewumi, I'm not boring. Thank you. I thought I was boring now because you people are not responding. You didn't respond in time. All right. Thank you. All right. So we now talk about it's taking you to see our response. It's taking you too long. Okay, no, it's not taking me too long to see response. I don't know. Okay, maybe, but I think you people can start follow me. That's the most important thing. Excuse me. All right. So what are your options of treatment? What are your options of treatment? Sorry, my hands are pinging. That's why I'm trying to. Um, all right. So what are your options of treatment? Divine Grace, thank you, Joe. All right. So now, how many are your patients? How many are your patients? Okay, I will check all these questions later. So what are the options of treating this problem? One, there's what we call flushing, tubal flushing. Um, there is actually no agreement on that option, majorly because some researches show that there is no difference in pregnancy outcome, while some said there is difference in pregnancy outcome if you do tubal flushing. However, you don't do tuber flushing. I mean, the only situation where tuber flushing will work is if it is something like that mucus plug that I talked about, that it is not something that has damaged the, the structure itself. If it's not a structural damage, if it's not something that uh, I'm much brighter on Facebook. Oh, okay, okay. Compared to Instagram, all right, okay. I don't know. I don't know. Maybe it's the other phone. Sorry. All right. So now, oh, I think it's because of this. It's trying to focus on this. If I'm not using this thing, it looks better. But when it's trying to focus, it changes the dynamics. I think that's why. That's why it's like that. All right. So tuber flushing, like I was saying, if you have mucus plug, so what we do with tuber flushing is we will introduce maybe chemical and salt. Sometimes it contains some other things. We will introduce it here under high pressure, just like HSD, just like what we do in HSD. We will introduce it here and allow it to move and see if it can flush out. Excuse me, excuse me. So and see if it can flush the mucus plug. But like I said, it is not for structural. It's not if there is structural damage. If there is structural damage already, flushing will not do anything. Flushing is just a waste of time. So if flushing can be done, fine. If it is due to mucus plug, flushing can push out. In fact, in some people, HSD has been found to after HSD, you just find out that about 3 to 6 months after HSD, they got pregnant. It is because of the effect of the flushing of the HSD that caused the pregnancy to occur. So that means that flushing, yes, I do flushing or sometimes. So flushing can be done um, to help with if it is mucus plug. Because in case you do the flushing and there is actually no improvement, so that you won't say that the person that did it maybe you don't do the right thing or the person just um, duped you. So it's not that the person duped you. Maybe what actually is the problem is that it's actually a structural problem. So if it's not a structural problem, if it's just due to mucus plug, then you may not have any issue with it. Now, there are other options. The other option is we can do what we call tuber surgery. I've done few tuber surgeries and I found out that from the tuber surgery, especially if we can if this place is blocked, if this place is blocked, we can create a new opening. We can create a new opening here such that we can give the chance for the egg to be able to pass through again. So, excuse me, once this place is blocked, that means there is no way the thing can move in. So, so we can create a new opening here, and once we create a new opening, we can give opportunity for egg to also and sperm to be able to meet again. However, uh, the success of tuber surgery, because there are different kinds of tuber surgery. There is the one that depending on how bad it is, we can remove the bad portion and join the good portion again. We can create opening on different parts to allow um, egg to enter and sperm to meet. We can do that one. And then the problem, what can determine the success of tuber surgery depends on the severity of how bad the damage is. If the tube is actually very damaged, there is really nothing, there is no amount of tuber surgery that you can do that will solve it. But if the tube is not bad and you can really, because at least I've seen there I've done for some women, some of them got pregnant, why some didn't get pregnant. Some got pregnant, why some did not get pregnant. So It can work for some people if the damage is not bad, but if there is a serious damage, tuber surgery will not work. Or if there is I was talking about the brush inside. If those brush if the brush has been destroyed, or if there are fibrosis, that means scars. If there are scars inside, or if it's total blockage, that means that tuber surgery will actually not do anything. But if the blockage is not bad, the tuber surgery can work. Then depending on the age of the woman too. If the woman is 35 years and above, I really don't advise you going for tuber surgery, because one, you are already going beyond um you are going beyond the time that your eggs are already, by the time you are getting 35 years and above, your eggs, the quality of your egg will start reducing. So you don't have to waste time waiting for tuber surgery, because sometimes even after the tuber surgery there can be closure of the opening. Once we open it, you can close again. So sometimes it may be a waste of time for some people. So if you are 35 years and above, I won't advise tuber surgery. But if you are 22, 23, fine, you can do it, because you still have a longer time to see if it can work. So, and sometimes God can be so good that He just wants tube that is blocked. If it's just one tube that is blocked, that means the other tube, except those people that have what we call ectopic pregnancy. Ectopic pregnancy is when pregnancy is supposed to be inside this place, but sometimes pregnancy will not stay inside. It can be outside, it can be on this tube, it can be, but majorly it's always inside this tube. Where the fertilization occurs, it will not, the fertilizer will not move, it will not start growing there. So if it start growing, it can rupture this tube. So we have to take the person into the theatre and stop the bleeding and remove the tube. We remove the tube. So in such instance, once we remove the tube, as long as the other tube is fine, that person can, you can have as many children as you want. Once this other tube is fine. But the thing is just that we may need to help you to stimulate eggs in both egg, because egg in most times egg will be stimulated in one ovary per time. So if this side is blocked, egg can be stimulated here for 2 months before it gets to this thing. But we can do some things that we can make egg to be stimulated in both ovary at the same time, so that your chances of getting pregnant is higher. So that, but the commonest, or the, I won't say the commonest, the better or the best option, let me say the best option out of the three that I've spoken about, the best option is in vitro fertilization, IVF. And what we do in IVF is this. Now we take the eggs from here, and we take the sperm, and we join them outside the body. Once we join them outside the body, we allow the sperm and the egg, the fertilized egg, we allow it to grow a bit. Once we find out that it has grown to an extent, we now take it and introduce it through this place into the womb. So we have boycotted or bypassed this thing. So that means naturally this is not possible again. So we have to artificially bring the eggs, fertilized egg, into the womb. So that is what IVF is all about. We take your egg, we remove your egg, we take sperm, we put them together and we join them together. And afterwards, once there is progress, we bring them into the womb and introduce them there. So that's what IVF is. So that is the major option for blocking. And if you have hydrosalpinx, in which there is accumulation of fluid in your tube, you may need to actually either remove the tube, or create opening that can drain out the water, such that it will make it easy, and then, and I mean, to make the success better for people that are trying to conceive. Now, how do you prevent tuber blockage? I think I can drop this one now. I've tried. My hands are paining me already. All right. So, how do you prevent tuber blockage? Um, the major prevention of tuber blockage is to prevent infection, because I told you that infection is the commonest um, cause of tuber blockage. So, as much as possible, you have to prevent infection. And through safer sex. You have to learn having safer sex, use of condom and all those stuff. It will help you to reduce sexually transmitted infection and reduce destruction of the tubes. Also, if you find that you have infection, you have to promptly treat the infection as soon as possible. And it is not over the counter drug that you go and use. You will go and see a doctor, and the doctor will examine you. They can do some tests for you before they conclude, okay, this drug is the best to treat you, is best to treat you, or that drug is better, or something. So that is the option, and that's the way you can prevent um, um, tubal blockage. Um, by and large, so that is the little thing about tubal blockage that you need to know. So I'll quickly take answers, I mean questions. So yeah, the problem with tubal blockage majorly is that it makes you to have problem with conception. And if you are able to conceive, it can lead to ectopic pregnancy if care is not taken. So that is the major complication of tubal blockage. So I can take question. You can send me your question and let me check if there are questions I need to answer here. All right. So I just did a test early. Yeah, we usually do it between 8 and 10th day of your cycle. That's when we usually do HSD. If you have questions, you can send. Okay, some people sent questions here. Okay. How much are your patients? I don't understand. How much are your patients are suffering post abortion? Do you believe in vaginal steaming? Well, actually, there are different. People talk about different options, different options of treatment of tubal blockage, vaginal steaming, using all sorts of things. I, for one, even um, research has not shown, apart from the three things I've talked about, research has not shown that those other options treat or resolve tubal blockage. I've seen all kinds of things that people use to treat tubal blockage, but research has not shown that um, they actually work. Um, like I said, that sometimes HSG can make you think you have tubal blockage, but when you repeat it or you go and do something we call laparoscopy, you can find out that your tubes are actually not blocked. Do you get? Then there's another thing we can do what we call recanalization. That one is through hysterosapingo, I mean hysteroscopy, in which they will introduce the thing through the vagina into the womb and and make a track for the tube from the womb. So those are the options that have actually been tested through research and different studies. I've not seen all the studies I've checked. Most of these other options are actually not, have shown that they don't work. How many are your, what is the, sorry, I'm trying to see the, I'm trying to see if there are questions on Facebook. I'll check Instagram later, but let me see Facebook first. Um, what is the solution for consistent miscarriage? We are not talking about miscarriage today. I will find the time to come and talk about miscarriage. But we are talking about tuber blockage today. I did HSG. Does that mean that my tubes are okay now? What was the result of the HSG? If you did the HSG, what did the HSG say? The HSG say that your tubes are blocked or your tubes are patent. If it says your tubes are patent, then that means that your tubes are fine. But if it says that your tubes are blocked, I can say that you try again and see if you can repeat it, or you can go for what we call laparoscopy, diagnostic laparoscopy to check it out. Can person with tuber blockage ovulate? Yeah. If there is no, if there is nothing against ovulation, if there is no hormonal imbalance, there are no other problems. This endometriosis that I talked about can also affect ovulation too. If there is no other problem than that tuber blockage, yes, the person can ovulate. But even if the person ovulates, it is useless. because there is no way the sperm and the egg can meet. As long as as long as those tubes are blocked, even if you ovulate from now till eternity, there is no way you can get pregnant naturally. You will need to conceive through what we call IVF, in vitro fertilization. That is what you will do for that. So it's not even about even about you ovulating. It's about the tubes functioning. After tuber calculation, can one have a yes, one can have a healthy baby. But once there is tuber calculation, that means you have made um you have made a passageway for the sperm to get to the egg and the fertilizer to come into the womb. So it's possible. You can have once that has happened, then you can have a normal baby. I did the stereoscopy and laparoscopy last 2 weeks, and the doctor asked me to come back for tuber cannulation. What are my chances for conception? Well, if the tuber cannulation, if well from the hysteroscopy and laparoscopy, they will have known that okay, cannulation can work for you, because not everybody that tuber cannulation can work for. Like I said, if the damage is not that bad, tuber cannulation can work. But if it is bad, if it is so bad and the tubes are severely damaged, tuber cannulation will not work. So for them to have told you that you come for tuber cannulation, because if tuber cannulation will not work, they should have told you to go for IVF. So that means that it's likely that tuber cannulation may work. Good evening, doctor. Is there a medical solution for the woman that does not ovulate? Well, I'm not talking about ovulation today. I will find another time to come and talk about ovulation. But if a woman is not ovulating, we will need to find out why you are not ovulating, so that we can treat. If we can find out why you are not ovulating, then we can treat the cause. You can check my yes. I think I talked about hormonal imbalance. I talked about polycystic ovarian syndrome. You can check my YouTube page. Ask Dr. Shea. You can subscribe to my YouTube page. It's free. You will be able to watch the videos. There are some videos there that talk about hormonal imbalance, that talk about hormonal imbalance, talk about polycystic ovarian syndrome. These are the these are the problems that can affect ovulation. So you can tell, but if you are having problem with ovulation, you need to be evaluated, and from the evaluation, we'll be able to say, okay, this is what we want to do for you. This is the option of treatment. Let me see. IUI is just we are not talking about IUI today, but let me just quickly say something about IUI. Is just a way by which we take usually if a man has suboptimal sperm, either the sperm is not moving well, or the amount of the sperm count is not as much as it should be. There is a criteria before you can do IVF, I mean IUI. If the sperm is not moving as it should, the sperm is slow, so that the time it will take to move from this vagina to where the tubes are, if it is too slow to get there, so that the egg will have died, because once the egg is released, by 24 48 hours, the egg will have died. So, and it shouldn't take the sperm more than 30 minutes to get there. But some sperm are so slow that they can take 1 week to get to that place. They can take 3 days, 2 days to get to that place. So what we do is we shorten that distance. We take the sperm, we wash it, we prepare it, and we take it directly into the womb, and deposit it inside the womb. And once we deposit it inside the womb, then it will shorten the time for, I mean, the distance the sperm will take to get to where the tubes are. So that's just the thing about IUI. How What can I do if only one tube is blocked? I've said it. If only one tube is blocked, the other tube is enough to get you pregnant. And like I said, we can help you, we can stimulate, we can work on your both ovaries to stimulate eggs at the same time. Because if one tube is blocked and the other tube is open, and the other ovary on that side that is open is not releasing egg, you can work that the two ovaries will grow egg and release it at the same time, so that you increase your chances of getting pregnant. But even if you don't do that, if you give yourself time, there will be a time that the ovary on that side of the tube that is open will also release egg. So even if you have one tube that is functional, that is good, you can get as much as 10 babies, you can give out to as many children as you want. So as long as you have one tube that is working, you are good to go. Please sir, I have two questions. One, what can one do to stop this? We are not talking about miscarriage today. I know that after the last miscarriage I have this pain at the left side of my abdomen, and I was told it's infection. I treated it like twice, but recently I started have the same. Um, I will encourage you to see a specialist to actually evaluate you and see what the problem is. Because for you to have miscarriages, there are different reasons why you have miscarriage. I think I'll find the time to come and talk about miscarriage. I've talked about it before. I think I did a collaboration with trying to tales tales of conception or something, or tales of trying to conceive or something. I can You can search for our page and you can go and watch the IGTV on our page. Tales of trying to conceive. Yeah, tales of trying to conceive. Tales of trying to conceive. You can go and watch the IGTV. There is one of the just scroll through our IGTV. There was one IG live that we did together that we talked about miscarriage. You can watch the video there, or I will find time to come and talk about miscarriage. Doctor, what causes cramps in the pelvic area from ovulation period to menstruation? People are asking something that but anyway, cramps can be due to ovulation itself. If you ovulate, you can have cramps. And there's something called premenstrual syndrome. It can be the reason why you're having cramps. I won't be able to dwell so much on it, but if you have cramps during ovulation, that means you have actually ovulated. It could be a sign that you ovulated. So, and it could be the reason why you have the cramps. Doctor, is it necessary for someone to go for HSG 2 months after a pupil surgery that ruptured one of the fallopian tubes? Once the surgeon tells you that the other tube is okay, there is nothing like seeing the tube directly. There is nothing like, because once when a woman has ectopic pregnancy and we operate, we will look at the other tube. As we are working on the tube that has ruptured, we are removing the other tube that has ruptured. We look at the other tube to look at how good the other tube is. And once we tell you that the other tube is good, means that the other tube is good. You don't need HSC for that. Except something else happens and is affecting your conception. But once your other tube is good, I don't think you should disturb yourself to go for another HSC. The result of HSC was the feature suggestive of bilateral tubal blockage, perifimbrial addition. So I didn't understand it. Well, Yasmin, it says that your tubes are blocked, that both of them are blocked. That is what bilateral tubal blockage means. And peripheral additions. Peripheral addition means that, like I talked about before, I said this place is what we call the fimbrial. It is where it has some leaves or some finger-like structures that attaches to the ovary. That is where the ovary will drop the egg. So that means there are additions around this place. That's what they mean that peripheral, that are around the fimbrial, that there is addition. So you may repeat, you may go for HS. I mean, I will advise you to go for laparoscopy, because in laparoscopy they will be able to see the problem and they will be able to remove, if it is something that they can work on. The additions can be freed during laparoscopy. So laparoscopy can be to check and to treat. So I will advise that you should go for a laparoscopy where the ovary, I mean the tubes will be viewed in real time, and if some form of treatment can be put in place, they can do additionalisis and free the additions around that place. So you should try and go for laparoscopy. It may help you out. But if you have money, you can go for IVF. IVF, you won't have to go through all this laparoscopy and all those things. Just as long as they didn't say that you have hydrocephalus, that means you can go for IVF, and IVF will be your better option. But if you want to do, if you want to, you can go for laparoscopy to recheck, and then they'll be able to tell you finally that your tubes are actually blocked, and if it is something that can be worked upon, it will be worked upon. You have two questions. Oluwatosin Bukola. What are the questions? You didn't list the question. Now you said you have two questions. What are the questions? Any other? Okay, I've answered your question on Facebook. Oluwatosin Bukola. I've answered your questions on Facebook. I've talked about when you talked about miscarriage, and I've talked about what you should do. I will find out to come and talk about miscarriage. I can't really talk about miscarriage today. Laparoscopy can be, yes, depending on how the kind of addiction. Laparoscopy can be a solution to addiction. If the addiction is not too bad, laparoscopy can be a form of addiction, I mean, a solution to addiction. Oluwatosin Bukola, um, I have told you to try and check Tales of Trying to Conceive. Tales of Trying to Conceive. Go and check her page and scroll to her IGTV. I talked about we had a collaboration. I talked about miscarriage. I explained everything about miscarriage. If you start talking about miscarriage, you will not stop. Or you can come and then we can talk. You can come for consultation and we can look at why you are having miscarriage. But my consultation is not free. So you can come for consultation and you can look at why you're having miscarriage. You can see what we can do for you. So that's it. So any other question before we close? So by and large, I hope I've been able to give you enough information about um, tuber blockage because it's a major problem in our environment. So tuber blockage, it can be treated if it's not that bad. And the option that I'm talking about is IVF. So you can also check my page. I've talked about a lot of things. I've talked about tuber blockage on my page. I talked about a lot of things. If you can scroll through the post, you will see all these things I've talked about. You can go through my IGTV. You can go through to my YouTube page, Ask Dr. Shere. There are a lot of topics that I've talked about too on Ask Dr. Shere. You can subscribe, try and subscribe to my YouTube page, Ask Dr. Shere. The subscription is free, so you can subscribe. Then you can go to my website. I have some videos on my website, www.askdrshere.com. You see some, but most of the videos there are not free. But there are some videos that are free. There's a video particularly that on options available to couples trying to conceive. On options available to couples trying to conceive. It is a free video. You can watch it to give you an idea of options that you can go for. And then you can also come for consultation. I have both online consultation and physical consultation. Now, the online consultation, anywhere you have, you can anywhere you have for online consultation, we can we can talk online. It's not free. You can send a DM to me on Instagram or on Facebook. Then I will tell you the process of the consultation. Then for physical, you can send a DM to me too. If you are in Lagos, we can arrange how you can do a physical consultation. So by and large, I think that Olamide, so I've said how you can meet me for consultation. You can just send a DM to me. Send a private message on Facebook or on Instagram to me. Then we can talk about how you can have consultation. By and large, I think we can close this. We can close the program. Abi, any other question? I hope you guys enjoyed um, today's lecture. Did you enjoy today's lecture? Can you let me know if you enjoyed today's lecture? Please let me know if you enjoyed today's lecture before we close. Did you enjoy it? After on the screen, what could be the cause? Let me know if you enjoyed the nobody is responding. All right, so we can call it a day then or a night. It was nice having you guys. Till another time, I'll find another time to come so that we can talk about something else. At least somebody talk about miscarriage. I'll try and see what we can do about that. Talk about miscarriage. Some talk about some other things that, as people ask me questions, I'll find time to come and talk about it. Oluwabukola, thank you. Our Royal Majesty, thank you too. God bless you too. So till another time, bye bye.